It's 9 days since the federal government announced restriction of movement in Lagos, Ogun State and the Federal Capital Territory. Thus far, the restriction appears to have worked, but the country is still recording newer COVID-19 cases. Delta and Katsina State, clear examples. Now, 254 confirmed cases of COVID-19. That is the total number after the Nigerian Center for Disease Control announced 17 new cases yesterday evening. 10 of the new cases in Lagos, 2 each in the FCT or your state, and 1 each in Delta and Katsina states. 44 cases have been discharged, 6 deaths have been recorded. A look at the breakdown of the cases in each of the states, showing Lagos with 130 cases, Abuja 50, Osun 20, Oyo and Edo 11 cases each. Bauchi has 6 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State, while Enugu, Ekiti, Kwara and Rivers each have 2 cases, with Ondo, Benue, Katsina and Delta states recording 1 case each. Now, the governor of Delta State, Ifeanyi Okowa, he has been talking about the index case, and that is in his state, the very first. We'll be connecting with him to get the latest update on that case, seeing as yesterday several measures were put in place with regards to palliatives and food banks for the people in the state. Now let's go over to Edo, where the governor there, Godwin Obaseki, today made a frightening revelation as he told the people in a state broadcast that unless the citizens conduct themselves better, there will be no more cases in the coming days. He also appealed to those who may have already been exposed to submit themselves for screening and proper handling.
As of today, Edo State has 11 confirmed cases and sadly 1 death from COVID-19. Unfortunately, from the evidence we now have, the number of cases are likely to increase significantly in the next few weeks, unless we take very drastic actions now to slow down the spread. We have gathered information that large numbers of our citizens who traveled back home in the last several weeks from overseas may not have self-isolated themselves. Although majority of the current cases are individuals with travel history and those of their relatives, in the coming days we are likely to see community transmission of the virus to people who do not have any travel history. As a result of these developments, we have to now adopt more stringent measures while still trying to protect the livelihoods of our people. Edo State government is very reluctant to have a total shutdown of the state because of the hardship it will cause to our people. However, if we are going to stop the spread of the virus, every person must be involved. It must be a shared responsibility. The government of Edo State will shut down any hotel found to be hosting guests who travel from outside the state and have not informed the COVID-19 response team to screen such guests. All government hospitals and primary health care centers and designated private clinics will be used as screening centers to screen citizens who believe that they may have been exposed or suspect that they may have symptoms of COVID-19.
The state governor there announcing those tough measures. Well, over in River State, the controversy over the alleged arrest of 2 pilots with Govt helicopters is still brewing in the state as the helicopter owners are appealing to the federal government to prevail on the state government to release its 2 pilots remanded in prison by a Port Harcourt magistrate court. The pilots were arrested for allegedly violating the executive order issued by the River State governor aimed at checking the spread of COVID-19 in the state. According to the Flight Crew Association in Nigeria, the pilots were operating essential oil and gas services. In response, the River State governor declared that he is willing to testify against persons who violate the state's border closure regulations. The governor was speaking at the office of the River State Commissioner of Police, where he insisted that the pilots illegally transported expatriates to the state. However, the helicopter service operator saying both itself and its clients have exemption approval to fly and continue operations in the oil and gas industry. Still talking more on the pandemic in Nigeria and across the world, also government's intervention so far. Joining us from the United Kingdom is Dr. Deji Olaleye. He is a physician with the National Health Service, NHS UK. Thank you for joining us on the program. Tell us, how are doctors coping with the shortages of personal protective equipment? It is said that some doctors are told to hold their breath to avoid getting infected.
Oh, thank you for the opportunity. With regards to the PPE over here, I can only comment on what I've been personally exposed to. I think that where I am, we have enough. I have no challenges myself finding the sort of protective equipment to use.
Tell us about what we're doing here in Nigeria. Some people are saying it's a few numbers in terms of comparing to the cases around the world, and a number of people are being discharged. How do you think we're handling things?
Well, from what I understand, from what I'm able to read on social media and around, I think Nigeria is doing quite a good job. It appears that for reasons that are not entirely clear at the moment, the pattern of disease spread is quite different as is what's obtainable in Europe at the moment. Nigeria is probably still, if it will progress beyond what it is, Nigeria is probably still in the early phases of the disease in terms of the fact that the number of cases they are getting, the pattern of the presentation, and the strategies required to manage them. So I think because Nigeria is still at a phase where lockdown and isolation can curtail the spread of the illness, I want to believe that the NCDC in Nigeria are doing a fantastic job at the moment.
Now, we hear the UK also reports a number of people coming out to take advantage of the brighter, sunny weather. Lagos is experiencing same. Social distancing in some areas are thrown out the window. How best do you think government can deal with this?
Well, I think they have to continue to re-emphasize the importance of the social distancing and stay-at-home measures. I don't think there's anything much more that they can do. Already in Nigeria, we've seen cases of high-handedness of the military and the police in dealing with these measures. I wonder if you're going to engage in physical restraints already and then further compromising the idea of social distancing. So I think they have to continue with public enlightenment, continue to sort of reorientate people. It's difficult, really, to expect that people will stay at home for such a period of time. But unfortunately, there is no other way. So I think it's just about the public information management strategies just have to continue to do over and over again.
We would like to appreciate your time, Dr. Deji Olaleye, physician, National Health Service, NHS UK. Thank you for joining us on the program. Well, over here in Lagos, we have Mrs. Israel Blessing, Chairman, National Association of Nurses and Midwives, Lagos State Chapter. Welcome to the program.
Thank you very much.
What's your observation since we experienced our index case here in Nigeria?
My observation is enormous. I want to say sincerely that Lagos State government have taken a proactive step, as well as Nigeria government as a whole, in ensuring that there are mitigating strategies in place to ensure that we curtail this disease, COVID-19.
Now, the World Health Organization, or rather, let's start with the risk, to health workers, especially the nurses and midwives, who make up a very large portion of our health workers. How do you think they're coping with this pandemic?
Nurses are coping with the pandemic, and at the same time, we are overwhelmed as nurses because we have few nurses in the field. And we believe that now a lot of volunteers have come out to support, to ensure that we curtail this disease, COVID-19. And there are a lot of challenges that nurses are facing presently in Nigeria.
All right.
The personal protective equipment are not sufficient. The welfare, transportation, there are those challenges that I see that is really stressing our members in various hospitals.
We've just been told that we have the Deputy Governor of Kano State, Dr. Nasiru Gawuna, and we also understand you are in charge of the task force on COVID-19. We'd like to welcome you to the program. Tell us what the measures are so far in Kano State.
Well, thank you and good afternoon. And the state of affairs in terms of COVID-19 in Kano is, as everybody knows, Kano is yet to record any positive occurrence, but we're preparing very well in terms, in case we have something like that. But in terms of prevention, we're doing all we can to see that we have done that. And we have set up various isolation centers to do with the intensive care, and then the normal isolation centers where we can house the first-hand cases before they got into the critical aspect. So far, the Sani Abacha Stadium has been set up to handle about 500 patients, and the Wanadawaki, which is the major ICU isolation center, has 72 beds with ventilators and all necessary health facility to handle any severe case.
Deputy Governor, just because we don't have a lot of time, sorry to cut in, but I must quickly ask you about some of the palliatives for the vulnerable in the state, what some of these measures are, if you can, in about 40 seconds.
Okay, the palliatives, we have received so far 364 million from different individuals, and food items that is worth, I think, over 200 and something million as of now. And we are working on modalities on how we can be able to distribute those goods. We are targeting about 300,000 households for that. And then other palliatives that have come is the issue of the conditional cash transfer, which already 15 local governments are going to benefit from that, because already the data and the people are there. Instead of the normal 5,000 for a month, now they are going to receive 20,000 each. That is money for 4 months collectively. And they have started that already with Pura local government, one of the local government yesterday, and now they are moving to other local governments out
Deputy
of the
Governor,
15 local governments.
We would like to appreciate your time and your contributions. Thank you so much. Wish we had more time on this issue, but we know we'll come to you. They're saying the state there has no case of COVID-19, but I'm sure that's also what the Delta State Governor and Katsina State Government thought as well. But we'd like to thank you, Mrs. Israel Blessing, as well. Thank you so much for joining us on the program. Still to come on the COVID-19 update, the city where the virus started, they've ended their lockdown. A glimmer of hope for other countries. We'll have more when we return. Welcome back. For now, there will be no Friday prayers in Katsina State. That's according to the government. This is coming after a meeting with the state government, religious leaders, traditional rulers and security operatives in the state. The meeting was convened to review the measures taken by the state government in preventing the spread of COVID-19 in the state. In a statement signed by the secretary to the state government, Dr. Mustafa Inua, people are strongly advised to maintain social distancing and strictly adhere to all rules and regulations as provided by health experts in fighting the disease. Still dissecting the COVID-19 impact in Nigeria and the world. Joining us in our Lagos studio is Dr. Adesina Adega. He's an immunologist, a research scientist from Mountaintop University. Thank you for joining us on the program. So, immunologists, first let's understand how it appears this virus attacks different people and the results are different from mild to moderate to severe.
Well, it depends on the intensity of the virus in each individual and how each individual is coping through the immune system of the body, how the immune system is attacking the virus and playing down, and we have so many factors determining that.
And this affects how it perhaps might affect older people more severely than younger people, or people with underlying illnesses.
The younger people and the older people, they have low immune system, while the active ones is still having very active immune system.
So is that why you think the cases that have been discharged, 44 so far, that they've had a very strong immune system that has helped them survive this?
Probably that. And I want to seize this opportunity to proclaim, to say something which is very important. Vitamin C has been found to be effective, and we're still on trial for total acceptance. But it's a control trial right now, and they're doing much about it so as to confirm it. But some people have been using it as a palliative treatment, palliative, I say, to control the severity of the disease. So that's what I've been. And here, we don't even need to be looking for vitamin C. We have so many vitamin C. Garlic, we eat it. Orange, we eat it. Tangerine, all the fruits that contain it. You can, as much as we doing that, then they'll be playing down the virus.
But that almost suggests that if you have the virus, and you're saying people who are self-isolating, if they take vitamin C and garlic, that...
It will reduce the severity. I'm not saying to kill. Severity, so that it will aid the recovery.
Okay, while we wait for perhaps the NCDC and, the Ministry of Health and perhaps the World Health Organization, what they have to say on that, you're an expert in vaccines, antimicrobial resistance. Tell us the race to getting a vaccine against COVID-19.
The vaccine is still a long road. In the sense that there are so many factors containing this. And then somehow the use of hyperimmunism, the plasma from the recovery patients, can still be playing a very good role. That is getting the plasma of recovered patients from this COVID-19, and then screening it for any infective organisms like HIV, hepatitis, and all that. Once they are screened, the plasma can be used. However, the plasma, the blood of the person donating the plasma must be of the same blood group with the patient. So that's an important factor if we are going to be adopting that in Nigeria.
All right, we'd like to inform you about this news that just in from Katsina State, an update that in the state, the ban on Friday prayers has been lifted. And the governor is, however, calling for caution. The ban on Friday prayers has been lifted, but the governor is also calling for caution. So social distancing still in place there. Well, let's return to this issue. The use of the plasma of the patient, because we heard this during the first index case, and how they can apply that to perhaps making, curing the other.
The use of the patient, the use of the plasma from the patient that recovered from the must be screened. Number one, it must be sure that the patient is totally free, recovered fully, and tested negative after 14 days of recovery. And then you're now screening for any infectious disease like HIV, hepatitis, and all that. And I said, however, the person must have the same blood group with the patient that will be receiving it.
All right, that's
Very,
interesting.
Very Sorry?
That's rather scientific, interesting.
Very important, because if there is a blood group, if I receiving mine, if your blood group is different from mine, it's going to create a problem.
We'd like to thank you. We know we'll have you a little bit more on the program, to expatiate on this. Thank you so much, immunologist, research scientist, Dr. Adesina Adega. Thank you for joining us on the program. And that's our COVID-19 special edition on Channels Television. Thank you for watching. Another 30 minutes update on the coronavirus pandemic comes up at 6 p.m. We'd like to hear from you in the meantime. Tweet at us. Social distancing still in place where you are, and self-isolation. Tell us. We'd like to hear. I'm Millicent Walker. Bye for now.